Hi everyone, Anna here with the Coding Guild. In today's episode, we are going to quickly review what Modifier 25 really is and how to know when we need it. Modifier 25 by definition denotes a significant, separately identifiable evaluation and management service by the same physician or other qualified healthcare professional on the same day of procedure or other service. Now the big question is, what counts as separately identifiable service? Separate from what exactly? The longer definition from Appendix A gives the following guidance. It may be necessary to indicate that on the day a procedure or service was performed, the patient's condition required a significant, separately identifiable EM service above and beyond the other service provided, or beyond the usual preoperative and postoperative care associated with the procedure that was performed. We have a little more help here. So the EM service must go above and beyond the other service provided. This part is easier to quantify. If there are two EM services provided, for example, and one of them goes above and beyond the other one, they are not inclusive of each other, then we will be able to bill both of them most of the times with Modifier 25. So the first part of the definition is understandable. But what is this beyond the usual preoperative and postoperative care? What counts as usual? What belongs to a procedure? Is there any EM associated with procedures? Is it what we are talking about here? Actually, yes. If you recall our global surgical modifier review, up in the corner and in the description below, procedures don't stand on their own. Payment for them includes more than just solely the intervention performed. Full payment is given for preoperative care, intraoperative care, and then postoperative care. All these three elements must be present to qualify for full procedural payment. Or to put it differently, there will be an EM service before the procedure, then the procedure, followed by other EM services where the patient receives aftercare. And all this is part of the same one lump sum payment for the procedure. Providers like to believe that there will be a payment here and then also here, but this is not how it works. Most procedures inherently involve evaluating and managing the patient. But why is that? Because best medical practice dictates that at least a minimum examination and last-minute decision-making be performed by any provider before they cut into their patients. They cannot just slap the patient onto the operating table and get down to it. First, the provider needs to check for worsening symptoms, new symptoms, or any new issues. They have to make sure that the patient is in good health, they have no allergies to anesthesia, that the patient took the necessary preoperative steps, and so on. In short, as part of the paid procedure, the provider ensures two things. One, does the patient still need the intervention? And two, can they withstand said intervention? As you can tell, this preoperative EM is a very important part of every procedure, and it makes good sense that payers require it to be performed as part of the procedural payment. Classic example is the laceration repair. The patient comes in with an obvious deep cut on their right hand. The provider quickly checks for contaminants, confirms drug allergy status, and then action. Complex repair is performed and the patient is sent home. Here, the pre-procedural evaluation is strictly focused on the upcoming procedure. If this EM service was a separate note, it would be about 2 sentences long and would hold almost no value on its own. It would be too little for legal purposes, too little for continuity of care. It wouldn't reveal almost anything about the patient. It only conveys information necessary to know for the upcoming procedure and nothing else. And here is where Modifier 25 comes in. If the provider performs more evaluation and management on the same day of service than would be strictly necessary for the procedure, we will have an additional EM code with Modifier 25 appended. Example, the same patient comes in with the same obvious cut on their hand, but now instead of quickly patching them up, the provider conducts an actual evaluation and management service. They ask, what happened? Did the patient fall? Was she attacked? Is it a kitchen accident? What cut the patient? A chainsaw? Rusty blade? broken shells? Does the patient experience any other symptoms beside the pain at the laceration site? Is the patient on any anticoagulants, insulin, opiates, or any other drug the provider should know about? There is also a hands-on exam to check around the site of the cut for possible nerve injury, foreign bodies, or anything else. As you might notice, these questions are not crucial to laceration repair. The procedure itself doesn't need to know whether the patient is on drugs or why the laceration happened. As far as the repair is concerned, there are only two things to know. Why are we doing it, and how can we do it? AKA, will the patient have any adverse events to a given numbing agent? That's it. All other information is nice, but unnecessary for the procedure. As a consequence, all these other questions will qualify as above and beyond of the usual preoperative service. And because they are not part of the preoperative service, like these questions were strictly related to the procedure, to the repair, these are included in the payment of this CPT repair code, but these aren't. Another solution will be necessary to get this work paid, and the solution is an additional EM code with modifier 25. This will show the payer that we performed a procedure, performed the mandatory evaluation directly related to said procedure, but then also went above and beyond the expectation and asked further questions. And now we would like to be paid for those further questions and the mental work they entailed. In summary, how to decide whether you need an additional EM code and modifier 25. Step number 1. Establish what is happening during the encounter. Is it a chit-chatty visit and a procedure? Or just the procedure may be scheduled ahead of time? Step number 2. Have a critical look at the note and ask yourself whether the procedure really needs all the info documented, or are there extra questions trying to figure something else out? In our patient example, we asked about possible other symptoms, we checked for nerve damage, we questioned whether the patient was attacked. In other words, we were trying to find something else than just the laceration. Check your note to see if that is going on, if the provider is trying to find an additional diagnosis or a personal or social problem. If so, they are probably going above and beyond routine preoperative services. Step 3. Check the global days of the procedure. Modifier 25 is used only for minor procedures, those with global days of 0 or 10 days. Other global day periods also exist, such as 90 days, XXX days, YYY days, and so on. See the Global Surgical Modifiers video for more details on those. And that is all about Modifier 25. I hope it was helpful. Thank you for being here with me today. I will see you soon in our next video.